examination as well. Right. No. You stay here, David. Right, so that was your knee examination. The thing is, if you have to do full examination, it takes time, obviously. It's not that little, it takes time. But again, as it is teaching station, wherever you're able to reach, that's absolutely fine. But I've seen some candidates, they say, okay, I am not going to reach to ligaments because these things are going to take time. But if you ask a question to your student, what do you want to learn? And he said, I want to learn spatial test for ligament, then what? So you never know. So make sure you practice this. The video is there on the YouTube. If you have got any query, just refer to the video as well. But yeah, you have to practice at least 8-10 times, then only we'll understand a bit. Because see, medicine, everybody, like when we are done with MBBS, we can treat medical patient, but ortho is a bit it's tricky, isn't it? So if you haven't practiced much in ortho, it sounds a bit tricky, right? So yeah, but after doing it a couple of times, we can manage. Now let's do hip examination. Let me put another slide. So now somebody was asking, like, do I? What they were asking? Yeah, do we have to examine the joints bilaterally? The thing is, it's a teaching station, so what I want to do, I will teach on one side only, isn't it? But if you remember what I did in the end, yes, to complete the examination, I'll be doing the examination of the other knee as well, one joint above, below, and neurological. So I did comment that in the end. So while teaching, just teach on one side, that should be okay, right? Okay, hip examination. Again, in the beginning, things will remain the same. First is rapport building. Ask what he wants to learn, what he already knows. He knows nothing. He wants to learn everything. Okay, we'll teach everything. We start with the look. Look is what? First, we tell the patient to stand in the anatomical position. Just join your legs and palm facing towards me, right? This is what you can say. And you check for the joints if they are in the same plane, like the shoulder joint, anterior superior iliac spine, knee and ankle, right? In the same plane. Once we are done with that, we can even check the gait of the patient as well. Same thing, and do the inspection from the front, from the side as well. Same thing you will do here as well, right? Now let's do palpation. There are some shortcomings, I would say, in the hip examination. Why? Because when you're doing knee examination, knee is exposed in the exam, so you can do everything in the knee. But do you think patient is fully exposed for hip examination? Not really. Patient is still wearing shorts, so there are a lot of things you may not be able to do in the exam. That's why quite commonly, you may not find this one, but knee is quite common, I would say that. Now, what should be the position of the couch? So you have to make the couch flat. So you do this in the abdominal examination and you do this in the hip examination. Make the couch flat, right? Okay, now we start with we have to do the temperature and tenderness. So as I said again, patient won't be like fully exposed, but how we can check? My friend, can we just move the couch a bit here as well? Your head is. Yeah, I think that should be fine. Yes. Okay, he's asking, I understood the question. So he's saying, like, when we do you can lie down. So when we do abdominal examination, we have to make sure the abdominal muscles are not taut. So what we do, we tell the patient to bend the leg. They don't tell the patient to bend the leg, but they have got something to do. You can ask the examiner can have the pillow. They'll give you two pillows, put one here and put one here. So when you put pillow here, what's going to happen? It's going to flex a bit like this. So automatically you will achieve what you want to achieve, but they don't tell the patient to bend the leg. Instead, they just put the pillow behind them, just beneath it. Right, okay, you can relax. So now hip. So now we are doing is the temperature. So what you can do is just compare the temperature of the hip joint, maybe to the other one, compare the temperature maybe with the thighs as well. Now you need to feel for some structure. So when we start from, okay, what is the first here, prominent structure that you can feel? ASIS. So one thing, remember, don't directly just jump here and feel for ASIS. Start from the abdomen. Slowly come down, and that's the most prominent structure that you can feel. That's your ASIS, anterior superior iliac spine. He's wearing the belt, so it's difficult for me. It's okay. So anterior superior iliac spine. After that, if I'm going back like this, what I'm feeling? Iliac crest. You can feel a bit like at the back or a bit up actually. You will go with the spine. On the side here, you can feel another structure. What's that? Greater trochanter. Sometimes when you press this area and it is painful, it's a sign of trochanteric bursitis as well. So what I did, abdomen, 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 I felt for ASIS. I'm going back, iliac crest, and on the side I'm feeling greater trochanter. And if there is any pain, it's trochanteric bursitis. Just remember that. Right. Okay, then there are a few more things we have to do. One thing we are doing is limb length. Here we have to check for limb length as well. We're gonna check what is true and what is apparent length. Because if patient had a surgery, patient might have true or apparent limb length discrepancy as well. So what I'm gonna do, you will get a measuring tape as well. I don't know where it is, but we can manage, it's fine. So what is true length? True length is from ASIS till medial malleolus. I think it is written other way around in the book. Yeah, it will be changed in the next step, but now you can change it maybe. So what is true length? From anterior superior iliac spine till medial malleolus. That's your true length. What is apparent length? Apparent length is from umbilicus or from xiphisternum till medial malleolus. True length from anterior superior iliac spine till medial malleolus. Apparent length is from umbilicus or xiphisternum till medial malleolus. So you need to check in both the sides, like this one, and this one, and this one. So you check if there is any true or apparent limb length discrepancy. Right, so that's how we can do. Then we have got movement, and we know hip can do lots of movement, right? Because unlike knee was only doing flexion extension, but here we can have flexion extension, we can have abduction, we can have internal external rotation as well. So let's talk about inspection. We said we're going to do active movement. So